Arizona, known for its breathtaking deserts, stunning sunsets, and vibrant cities, is facing a growing crisis that's impossible to ignore: homelessness. In this video, we'll uncover the alarming reality behind the numbers, explore the root causes, and discuss what's being done to address the issue. Stick around to the end as we explore how you can help make a difference. Arizona has one of the fastest growing homeless populations in the United States. In 2023, there were over 13,000 people experiencing homelessness on any given night. Shockingly, a large percentage of them are families and children. In cities like Phoenix and Tucson, shelters are overflowing, forcing many to live on the streets or in makeshift encampments. Number 10. Rising population growth. Arizona has long been a destination for people seeking a better quality of life. With its sunny weather, lower cost of living compared to states like California, and ample job opportunities in industries such as technology, healthcare, and manufacturing, the state has experienced one of the fastest population growth rates in the country. In fact, cities like Phoenix, Tucson, and Mesa have consistently ranked among the fastest-growing urban areas in the U.S. over the last decade. While this growth has brought economic benefits, it has also created challenges, one of which is the increasing number of individuals and families experiencing homelessness. Population growth, while generally viewed as a positive economic indicator, has placed significant strain on Arizona's housing market. As more people move into the state, the demand for housing has surged, causing prices to skyrocket. Over the past few years, the median cost of renting an apartment in Arizona has increased by over 30%, and the price of homes has also risen dramatically. While this may be good news for homeowners and developers, it spells disaster for low-income individuals and families who are already struggling to make ends meet. The state's inability to build affordable housing fast enough to meet the needs of its growing population has exacerbated the crisis. Another consequence of this rapid growth is the increasing competition for jobs and resources. While Arizona's unemployment rate is relatively low, many of the jobs available are in low-wage sectors, such as retail, hospitality, and food service. These jobs often fail to provide a living wage, making it difficult for workers to afford housing in an increasingly expensive market. For many, even working full-time is not enough to cover rent, utilities, and other basic living expenses. As a result, a growing number of people are falling into homelessness despite being employed. Moreover, the infrastructure and public services in Arizona have struggled to keep up with the population boom. Homeless shelters, food banks, and other support systems are often at capacity, leaving many without the help they need. The increased demand for services has stretched nonprofit organizations and government agencies to their limits, making it harder to provide adequate support for those experiencing homelessness. The rapid growth has also led to tensions within communities. Longtime residents may feel frustrated by the changes brought about by an influx of new people, such as increased traffic, higher housing costs, and overcrowded schools. Some communities have responded by enacting policies that make it more difficult for homeless individuals to live in certain areas, such as bans on camping in public spaces or restrictions on panhandling. While these measures may address the visible symptoms of homelessness, they do little to address its root causes. Addressing the impact of population growth on homelessness requires a multifaceted approach. Policymakers must prioritize the development of affordable housing, implement rent control measures, and expand access to social services. Additionally, Arizona must invest in long-term planning to ensure that its infrastructure and public services can keep pace with future growth. By addressing these issues head-on, Arizona can create a more inclusive and equitable future for all its residents. Number 9. Eviction rates. Eviction is one of the primary pathways into homelessness for many individuals and families in Arizona. The state has some of the highest eviction rates in the country, with thousands of cases processed every month. In Maricopa County alone, more than 50,000 eviction filings were reported in 2023, a sharp increase compared to previous years. This alarming trend is driven by rising rents, stagnant wages, and a lack of tenant protections, leaving many residents vulnerable to losing their homes. The process of eviction can be devastating. For many tenants, the inability to pay rent stems from unforeseen circumstances, such as job loss, medical emergencies, or an unexpected increase in living expenses. Once an eviction notice is served, tenants often have very little time to respond or find alternative housing. In Arizona, the legal process for eviction moves quickly, often giving renters as little as 5 days to pay overdue rent or vacate their homes. This rapid timeline leaves little room for negotiation or assistance, pushing many into homelessness almost overnight. Once evicted, the challenges compound. Many landlords conduct background checks and refuse to rent to individuals with an eviction on their record. This creates a significant barrier to securing future housing, forcing evicted families to turn to overcrowded shelters, live in their vehicles, or set up tents in encampments. The stigma of eviction also impacts individuals' mental health, causing feelings of shame, anxiety, and hopelessness. The financial strain of eviction extends beyond rent. Moving costs, storage fees for personal belongings, and the potential loss of income due to the disruption all contribute to the cycle of poverty. Families with children face additional difficulties, as unstable housing disrupts education and creates emotional distress for young ones. Addressing Arizona's eviction crisis requires systemic change. First, there must be stronger tenant protections. Many states offer right-to-counsel programs where low-income tenants receive legal representation during eviction proceedings. In Arizona, such programs are limited, leaving most tenants to navigate the complex legal system alone. Expanding access to legal aid could help prevent unjust evictions and give tenants a fighting chance. Second, emergency rental assistance programs must be adequately funded and accessible. During the COVID-19 pandemic, federal and state governments implemented rental assistance programs that helped thousands of Arizonans avoid eviction. However, as these programs ended, many residents found themselves back at risk. Reviving and expanding such initiatives could provide a safety net for those facing temporary financial hardships. Lastly, the root causes of eviction must be addressed. This includes creating more affordable housing, raising the minimum wage to match the cost of living, and implementing rent control measures to curb excessive rent hikes. By tackling these issues, Arizona can reduce the number of evictions and prevent more families from falling into homelessness. Evictions are not just a symptom of economic instability. They are a driver of homelessness. By prioritizing tenant protections and expanding support systems, Arizona can take meaningful steps toward ending its eviction crisis and reducing homelessness across the state. Number 8. Lack of affordable housing. The lack of affordable housing is perhaps the most significant factor contributing to homelessness in Arizona. Despite the state's rapid population growth and booming economy, the availability of affordable housing has not kept pace with demand. This has created a severe shortage, leaving many residents unable to find a place to live that fits their budget. For decades, Arizona has been known as an affordable place to live, attracting individuals and families from more expensive states like California and New York. However, this reputation has changed in recent years. The median rent for a one-bedroom apartment in Phoenix, for example, has risen to over $1,300 per month, a 30% increase over just a few years. Meanwhile, wages for low- and middle-income workers have remained stagnant, making it increasingly difficult for them to afford housing. The problem is further exacerbated by the state's emphasis on building luxury housing. Developers often prioritize high-end apartments and homes because they generate greater profits. As a result, there is a glaring gap in the availability of low-income housing. For every 100 extremely low-income households in Arizona, there are fewer than 30 affordable and available rental units. This shortage forces many residents to spend a disproportionate amount of their income on housing, leaving little left for other necessities like food, healthcare, and transportation. The lack of affordable housing also makes it nearly impossible for homeless individuals to transition back into stable living situations. Without affordable options, Many remain stuck in shelters or on the streets. Families with children are particularly vulnerable, as they struggle to find housing that accommodates their needs and fits their budget. Addressing this crisis requires a multifaceted approach. First and foremost, Arizona must increase its investment in affordable housing development. This can be achieved through tax incentives for developers who build low-income housing, subsidies for nonprofit housing organizations, and public-private partnerships. Additionally, zoning laws should be revised to allow for more affordable housing projects in urban and suburban areas. Another solution is the implementation of rent control policies to prevent landlords from dramatically increasing rents in high-demand areas. While controversial, rent control can provide stability for low-income renters and prevent them from being priced out of their homes. Finally, housing assistance programs must be expanded to reach more people. This includes providing rental vouchers for low-income families, offering financial assistance for first-time homebuyers, and creating programs to help individuals transition from homelessness to stable housing. The lack of affordable housing is a systemic issue that requires bold action and long-term planning. By addressing this problem, Arizona can not only reduce homelessness, but also create a more equitable and inclusive society where everyone has access to safe and affordable housing. Number 7. Mental health challenges. Mental health challenges are a significant factor driving homelessness in Arizona. Many individuals experiencing homelessness are dealing with conditions such as depression, anxiety, PTSD, bipolar disorder, and schizophrenia. These conditions can severely impact their ability to maintain employment, manage personal finances, and sustain stable housing. Unfortunately, Arizona's mental health care system is underfunded and overwhelmed, leaving many people without the support they need to overcome these challenges. For individuals with untreated mental health conditions, maintaining stability becomes a constant struggle. A person suffering from severe depression, for example, might find it impossible to hold a job due to lack of motivation or energy. Similarly, someone dealing with schizophrenia may face stigma, misunderstanding, and difficulty accessing necessary resources. Without a steady income or social support, these individuals often find themselves unable to pay rent, leading to eviction and homelessness. Arizona's mental health care system has struggled to meet the growing demand for services. According to recent data, Arizona ranks near the bottom among states for access to mental health care. Many low-income residents lack health insurance or cannot afford out-of-pocket costs for therapy, medication, or psychiatric services. Even when services are available, long wait times and bureaucratic hurdles often deter people from seeking help. The link between homelessness and mental health is cyclical. Living on the streets exacerbates existing mental health conditions due to the constant stress, trauma, and lack of safety. The absence of basic needs such as food, shelter, and medical care creates an environment where mental health deteriorates further. For those without access to care, this cycle becomes almost impossible to break. Stigma is another major barrier to treatment. Many individuals fear being judged or labeled for seeking help, which prevents them from accessing available resources. For homeless individuals, this stigma is even greater, as society often views homelessness as a personal failing rather than a systemic issue. To address the intersection of mental health challenges and homelessness, Arizona must take a multi-pronged approach. First, the state needs to invest in expanding mental health services, particularly for low-income and homeless individuals. Mobile crisis teams and outreach programs can bring mental health care directly to those who need it, removing barriers to access. Second, funding for affordable mental health clinics and subsidized medication must be increased. Ensuring that individuals can receive treatment without financial strain is essential for breaking the cycle of homelessness. Additionally, integrating mental health care with housing programs can provide a holistic approach to recovery. Programs like Housing First, which prioritize stable housing as a foundation for addressing other issues, have shown success in reducing homelessness among individuals with mental health challenges. Finally, community education and anti-stigma campaigns are crucial. By fostering understanding and empathy, Arizona can create a more supportive environment for individuals struggling with mental health conditions. Addressing these challenges will not only reduce homelessness, but also improve the overall well-being of Arizona's communities. Number 6. Substance abuse and addiction. Substance abuse and addiction are both causes and consequences of homelessness in Arizona. Many individuals who experience homelessness struggle with addiction to drugs or alcohol, either as a result of circumstances that led to homelessness or as a way to cope with the challenges of living on the streets. Unfortunately, limited access to treatment and societal stigma make it difficult for those battling addiction to find the support they need to recover. Addiction can often lead to homelessness due to its impact on a person's ability to maintain stability. Substance use disorders can result in job loss, strained relationships, and financial instability, which are all precursors to losing housing. For individuals already living paycheck to paycheck, addiction can tip the balance, pushing them into homelessness. On the flip side, homelessness often exacerbates substance abuse. Living on the streets is an incredibly stressful and traumatic experience. Many individuals turn to drugs or alcohol as a means of escaping the harsh realities of their situation. However, this coping mechanism often creates a cycle of dependency that makes it even harder to escape homelessness. Access to addiction treatment in Arizona is limited, particularly for those who are uninsured or living in poverty. Many rehabilitation programs have long wait lists, high costs, or restrictive eligibility criteria, which prevent individuals from getting the help they need. For homeless individuals, these barriers are even more pronounced, as they often lack the resources or transportation needed to access treatment. Arizona also faces a growing opioid crisis, which has disproportionately impacted low-income communities. The rise of fentanyl and other synthetic opioids has made addiction more dangerous and difficult to treat. Overdose rates among homeless individuals have increased significantly, highlighting the urgent need for intervention. Addressing substance abuse among Arizona's homeless population requires a compassionate and comprehensive approach. First, the state must expand access to affordable addiction treatment. This includes increasing the availability of detox programs, inpatient and outpatient rehabilitation centers, and medication-assisted treatment for opioid addiction. These services should be offered on a sliding scale or free of charge to ensure accessibility for all. Second, harm reduction strategies must be implemented to reduce the risks associated with drug use. Programs such as needle exchanges, safe consumption sites, and naloxone distribution can save lives and provide an entry point for individuals to seek treatment. Third, integrating addiction treatment with housing programs can create a supportive environment for recovery. Initiatives like sober living homes and supportive housing programs for individuals in recovery have shown success in helping people rebuild their lives. Finally, public awareness campaigns and community education are essential to reducing stigma and fostering understanding. Addiction is a complex issue that requires empathy and support, not judgment. By addressing substance abuse with compassion and providing the necessary resources, Arizona can help individuals overcome addiction and break the cycle of homelessness. Number 5. Impact of inflation. Inflation has become a pressing issue across the United States, and Arizona has not been spared. The rising cost of living, driven by inflation, has significantly impacted residents, particularly those with low or fixed incomes. Essentials such as food, gas, healthcare, and housing have become increasingly expensive, leaving many unable to afford their basic needs. This financial strain has pushed countless individuals and families in Arizona to the brink of homelessness, with little relief in sight. Housing is one of the areas most affected by inflation. The cost of renting or purchasing a home in Arizona has skyrocketed over the past decade, with rental prices seeing double-digit percentage increases in just a few years. Even modest apartments that were once affordable for low-income residents are now out of reach for many. For individuals living paycheck to paycheck, even a slight increase in rent can lead to eviction, as there is often no financial cushion to fall back on. Inflation also drives up the cost of utilities, which adds another layer of financial burden. In a state like Arizona, where summer temperatures routinely exceed 100 degrees Fahrenheit, air conditioning is not a luxury. It's a necessity. However, rising electricity costs have left many struggling to keep up with their bills. Families are forced to make difficult choices, such as whether to pay for utilities or purchase food, and these impossible decisions often lead to financial instability. Another area where inflation has taken a toll is transportation. With gas prices reaching record highs, commuting to work or accessing essential services has become increasingly expensive. Public transportation options in Arizona, particularly outside of major cities like Phoenix and Tucson, are limited, leaving many residents dependent on personal vehicles. For those who can no longer afford fuel, maintaining employment and accessing resources becomes a significant challenge, pushing them closer to homelessness. The rising cost of healthcare is another factor contributing to homelessness. Medical emergencies or chronic conditions can quickly drain a family's savings, especially when coupled with high insurance premiums and out-of-pocket expenses. For many, the financial strain of medical bills is the final push into homelessness. To address the impact of inflation on homelessness, Arizona must implement targeted policies to support its most vulnerable residents. Expanding affordable housing programs is critical, as is offering rental assistance to low-income families. Utility assistance programs should also be funded to ensure that residents can maintain access to essential services during times of financial strain. Furthermore, Arizona should focus on raising wages to better match the cost of living. While the state's minimum wage has increased in recent years, it still falls short of what is needed to afford basic necessities in today's economy. Advocating for higher wages and implementing policies that support income growth for low and middle-income workers can provide a buffer against the effects of inflation. Lastly, financial literacy and assistance programs can help residents navigate the challenges of inflation. Teaching budgeting skills, providing access to emergency funds, and connecting individuals to community resources can prevent financial crises from escalating into homelessness. The impact of inflation is far-reaching, but with proactive measures, Arizona can mitigate its effects and prevent more individuals and families from losing their homes. Number 4. Overcrowded shelters. Arizona's homelessness crisis has put immense pressure on its emergency shelter system. As the number of people experiencing homelessness continues to rise, shelters across the state are struggling to keep up with demand. Many facilities are operating at or above capacity, leaving countless individuals and families without a safe place to stay. For those who rely on shelters, overcrowding presents numerous challenges. The lack of available space means that some people are turned away, forced to sleep on the streets or in their vehicles. Families with children face the added stress of finding safe and secure accommodations, as shelters that can accommodate families are often in short supply. Overcrowding also impacts the quality of services provided. When shelters are overwhelmed, staff and resources are stretched thin, making it difficult to address the individual needs of residents. Case management, job training, mental health services, and addiction treatment, key components of transitioning out of homelessness, become harder to provide in an overcrowded environment. The physical conditions in overcrowded shelters can also be problematic. Shared spaces increase the risk of spreading illnesses, particularly during cold and flu season. Residents may face long waits for basic necessities like showers and meals, leading to frustration and stress. For individuals already dealing with trauma or mental health challenges, these conditions can exacerbate their struggles. One of the reasons for overcrowding is the lack of long-term housing options. Many shelters are designed to provide short-term assistance, but with affordable housing in short supply, residents often have nowhere to go when their stay ends. This bottleneck prevents new individuals from accessing shelter and perpetuates the cycle of homelessness. To address overcrowding, Arizona must invest in expanding its shelter capacity and creating more long-term housing solutions. Building additional shelters and renovating existing ones to increase capacity can provide immediate relief for those in need. Additionally, The state should focus on prevention strategies to reduce the number of people entering homelessness. Rental assistance programs, eviction prevention services, and affordable housing initiatives can help individuals and families maintain stability and avoid the shelter system altogether. Partnerships with nonprofit organizations and faith-based groups can also play a vital role. These organizations often have the resources and community connections needed to provide additional shelter and support services. By working together, Arizona can create a more robust safety net for its homeless population. Lastly, addressing the root causes of homelessness, such as mental health challenges, substance abuse, and unemployment, will help reduce the demand for shelters in the long term. Providing comprehensive support and resources can empower individuals to achieve stability and independence. Overcrowded shelters are a symptom of Arizona's larger homelessness crisis. By taking action to expand capacity and address underlying issues, the state can ensure that everyone has access to safe and supportive housing. Number 3, veteran homelessness. Veteran homelessness is a significant issue in Arizona, as it is across the United States. Arizona is home to a large population of military veterans, many of whom struggle with reintegration into civilian life after their service. For some, the challenges of adjusting to a new way of life, combined with mental health issues, physical disabilities, and financial instability, lead to homelessness. Despite efforts to address this issue, thousands of veterans in Arizona still lack stable housing. One of the primary contributors to veteran homelessness is mental health. Many veterans return from active duty with conditions such as post-traumatic stress disorder, PTSD, depression, or anxiety. Without proper treatment and support, these conditions can make it difficult to maintain employment or relationships, ultimately leading to housing instability. Unfortunately, accessing mental health care can be challenging for veterans, particularly those who live in rural areas or lack transportation to Veterans Affairs VA facilities. In addition to mental health issues, physical disabilities sustained during military service can limit veterans' ability to work and earn a steady income. Chronic pain, mobility issues, and other health conditions often require ongoing medical care,